Hey everyone, welcome back to the Care Plus channel. In today's video, we're talking about breastfeeding health tips. Breastfeeding is a beautiful gift you give to your baby. It's more than just food. It's a special bond, full of love and comfort. But we also know it can be tricky at first. Don't worry, we're here to help. This guide will teach you everything about getting a good latch. A good latch means your baby is attached to your breast the right way. This helps them get enough milk and keeps you comfortable. We'll cover all the important stuff: how to get a deep latch, how to avoid pain, and what to do if you have problems. Remember, every mom and baby is different. What works for one might not work for another. Be patient, trust your instincts, and don't hesitate to ask for help. We're here to support you on your breastfeeding journey. Let's talk about the deep latch. Before we dive into the rest of the video, if you haven't subscribed to my channel Care Plus yet, I'd really appreciate it if you could hit that subscribe button, like, and share this video. It helps me a lot in creating more health-related content for you. Now let's get into it. It sounds simple, but it makes all the difference. When your baby has a deep latch, they take a big mouthful of your breast, not just the nipple. Think of it like this. Imagine eating a hamburger by just nibbling on the edge of the bun. You wouldn't be very full, right? It's the same for your baby. A shallow latch means they're only getting a little bit of milk, and it can hurt your nipples. With a deep latch, your baby can efficiently draw out milk, helping them feel full and satisfied. And guess what? It's much more comfortable for you too. No more sore nipples. Ready to learn the secrets of a perfect latch? Follow these easy steps. Get comfy. Finding a comfortable spot is crucial for both you and your baby. Whether it's a cozy chair, a bed, or a special breastfeeding nook, make sure you feel relaxed and supported. Choose a position that feels good for both you and your baby. There are several positions you can try, such as the cradle hold, the football hold, or even lying down. Experiment to see what works best for you. You can try lying down, sitting up, or using a breastfeeding pillow for support. These pillows can help elevate your baby to the right height and reduce strain on your arms and back. Gently hold your breast with your hand, forming a C shape with your thumb and fingers. This technique helps you guide your breast into your baby's mouth more easily. This helps guide your baby's mouth towards your nipple. It's important to support your breast without pressing too hard, allowing your baby to latch on naturally. Bring your baby close to your breast with their nose pointing towards your nipple. This alignment helps ensure a deep latch, which is essential for effective breastfeeding. Gently tickle their nose with your nipple to encourage them to open wide. This action stimulates their natural rooting reflex, making them more likely to latch on correctly. Be patient and wait for your baby to open their mouth really wide, like a big yawn. A wide open mouth is key to a good latch, allowing your baby to take in more of your breast. You want their tongue cupped down and their lips flanged out. This positioning helps create a strong seal and ensures your baby can effectively draw milk. Once your baby's mouth is wide open, quickly bring them towards your breast, aiming your nipple towards the roof of their mouth. This helps your baby latch deeply and comfortably. Their chin should touch your breast first. This helps your baby tilt their head back slightly, making it easier to latch on deeply. Make sure your baby has taken a big mouthful of your breast, with their lips sealed around the areola, the dark area around your nipple. A good latch covers more than just the nipple, ensuring your baby gets enough milk. Their nose should be free and clear. This allows your baby to breathe easily while feeding, making the experience more comfortable for both of you. If needed, gently adjust your baby's position to keep their nose unobstructed. Remember, practice makes perfect. Don't be discouraged if it takes a few tries to get the latch just right. With patience and persistence, you and your baby will find your rhythm and enjoy the special bonding time that breastfeeding provides. Every mother and baby pair is unique, so what works for one may not work for another. Trust your instincts, seek support from lactation consultants if needed, and cherish these precious moments with your little one. A successful latch is the foundation of a positive breastfeeding experience. It ensures your baby gets the nutrition they need while keeping you comfortable and pain-free. Happy breastfeeding! Section 4. Breastfeeding without pain. Tips for a comfortable experience. Breastfeeding shouldn't hurt. It should be a bonding experience between you and your baby, filled with comfort and joy. However, it's not uncommon for new mothers to experience some discomfort initially. The good news is, with the right techniques and tips, you can make breastfeeding a pleasant experience for both you and your little one. Here are some tips to prevent and manage any discomfort you might face during breastfeeding. These tips are designed to help you navigate through the initial challenges and ensure a smooth breastfeeding journey. First and foremost, a deep latch is key. A proper latch ensures that your baby is getting enough milk and that your nipples are not being subjected to unnecessary friction. Remember, a deep latch is your best friend. It might take a few tries to get it right, but once you do, it will make a world of difference. Your baby should have a mouthful of breast, not just the nipple. A deep latch ensures efficient milk transfer and minimizes nipple soreness. It also helps your baby to feed more effectively, which means they will be more satisfied and you will be more comfortable. Second, switch it up. Don't be afraid to experiment with different breastfeeding positions. Each position has its own benefits and can help in different situations. For example, the cradle hold is great for a relaxed feeding session, while the football hold can be useful if you have a strong letdown reflex. Changing positions regularly helps distribute pressure on your nipples and prevents soreness. It also allows you to find the most comfortable position for both you and your baby. You might find that certain positions work better at different times of the day or as your baby grows. Next, nipple cream to the rescue. Nipple creams are specially formulated to soothe and protect your skin. They can be a lifesaver in the early days of breastfeeding when your nipples are still getting used to the new demands. If your nipples are sore, apply a lanolin-based nipple cream after each feeding. This will help to keep your skin moisturized and prevent cracking. Make sure to choose a cream that is safe for your baby, as they will be in contact with it during feeding. It helps soothe and protect your delicate skin. You can also use breast milk as a natural remedy. Simply express a few drops and rub it into your nipples. Breast milk has natural healing properties that can help to soothe soreness. Fourth, break the latch gently. If you need to detach your baby for any reason, it's important to do it carefully to avoid causing pain or damage to your nipples. If you need to detach your baby, gently insert your finger into the corner of their mouth to break the suction before pulling them away. This will help to prevent any sudden pulling or tugging that can cause discomfort. Fifth, feed frequently. Frequent breastfeeding keeps your breasts from becoming engorged, which can cause discomfort. Engorgement can make it difficult for your baby to latch properly and can lead to blocked ducts or mastitis. Aim for 8 to 12 feedings in a 24-hour period. This might seem like a lot, but frequent feeding helps to establish your milk supply and keeps your baby well fed and content. And finally, tongue tie check. If you suspect your baby has a tongue tie, a tight frenulum that restricts tongue movement, it can affect their ability to latch properly and cause pain for you. Consult with a lactation consultant or healthcare professional. They can assess your baby and provide guidance on the best course of action. Sometimes, a simple procedure can correct the issue and make breastfeeding much more comfortable for both of you. Section 5. Overcoming common hurdles. Solutions for a smoother journey. Every breastfeeding journey has its ups and downs. It's a beautiful and natural process, but it can also come with its fair share of challenges. Understanding these challenges and knowing how to address them can make the journey smoother and more enjoyable for both mother and baby. Here are some common challenges and how to overcome them. First, engorgement. This is a common issue that many mothers face, especially in the early days of breastfeeding. If your breasts are overly full and uncomfortable, try applying warm compresses before feeding, gently massaging your breasts, and hand expressing a small amount of milk to relieve pressure. These methods can help to soften the breast tissue and make it easier for your baby to latch on. Second, nipple pain. Persistent nipple pain, despite a deep latch, could indicate a tongue tie, thrush, or other issues. It's important to address nipple pain promptly to prevent further complications and ensure a comfortable breastfeeding experience. Consult with a lactation consultant or healthcare professional for guidance. They can help identify the root cause of the pain and provide effective solutions. Next, low milk supply. Ensure you're feeding frequently, staying hydrated, and getting enough rest. These are crucial factors in maintaining a healthy milk supply. Additionally, stress can impact milk production, so finding ways to relax and take care of yourself is important. Consider trying galactagogues, foods, or supplements that may boost milk production in consultation with your healthcare provider. Foods like oats, fenugreek, and fennel are often recommended. Supplements should be taken under professional guidance to ensure they are safe and effective. And lastly, sleepy baby. If your baby tends to fall asleep while nursing, try undressing them, gently stroking their cheek, or switching positions to keep them awake and engaged during feedings. Keeping your baby awake ensures they get enough milk and helps stimulate your milk production. Remember, every breastfeeding journey is unique, and it's okay to seek help and support when needed. With the right strategies and support, you can overcome these common hurdles and enjoy a smoother breastfeeding experience. Section 6. Signs of a perfect latch, ensuring your baby is feeding effectively. How do you know if your baby is latching correctly and getting enough milk? Look for these signs. First, comfortable feeding. You should feel a gentle pulling sensation, not pain, when your baby is latched on. Second, swallowing sounds. Listen for audible swallowing sounds as your baby nurses. This indicates they're actively drinking milk. Next, areola coverage. Your baby's mouth should cover most of the areola with their lips flanged out like a fish. And finally, satisfied baby. After feeding, your baby should appear content, relaxed, and have wet and dirty diapers as expected for their age. Section 7. Embrace the journey. Seeking support for a rewarding experience. Congratulations on embarking on this beautiful breastfeeding journey. Remember, you're not alone. Seek support from your partner, family, friends, and healthcare providers. Lactation consultants are incredible resources who can provide personalized guidance and address any challenges you may encounter. Trust your instincts, be patient with yourself and your baby, and celebrate each milestone along the way. Breastfeeding is a journey of love, nourishment, and an unbreakable bond between you and your little one. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips. Thanks for watching, and I'll see you in the next video.